Okay, buckle up, everyone, because today we are diving into the world of the human nervous system,
The nervous system.
specifically head and spine injuries.
Ah, yes.
You have given us a lot of material on this one. EMT textbooks, lectures, anatomical
It's a
diagrams.
lot to unpack.
It is a lot to unpack, but our mission here is to help you recognize these injuries and just understand the impact that they can have.
Because you never know.
You really never know.
Right, like, are you prepping for an exam? Are you just brushing up on some first aid? Or are you just really curious about, how your body works?
Yeah, like how much damage can I actually sustain
Exactly.
before it's a real problem?
So we're talking about your brain and your spinal cord,
Okay,
which together they make up the central nervous system.
which is a pretty important system.
It's kind of important, I would say.
Essential.
It's responsible for literally everything you do.
Okay, so this is like a no-pressure system right here.
Right.
This is like walking, talking, breathing.
Every single thing.
Starts there.
Starts there. And here's the thing. These cells, unlike a lot of other cells in your body, they can't regenerate once they're damaged.
Oh, wow.
So that's what makes this so important.
So the stakes are really high then.
The stakes are very high when it comes to these injuries.
So it's kind of like our brain and our spinal cord. They're like the VIPs, but
Yes.
they're very vulnerable VIPs.
They're very important, but also very vulnerable, and that's why they have so much protection.
Okay, so tell me about their security detail.
Okay, so you've got bone, right?
Okay?
That's the most obvious one.
The skull.
The skull, that thick, bony structure that encases your brain. And then you have your spinal canal that's protecting your spinal cord.
So that's like our body's like natural armor in a sense.
It's very strong. It's designed to withstand a lot.
Okay, but it doesn't stop there.
Oh, no, no, no. We've got layers.
Layers on layers.
Layers upon layers.
Of protection.
Of protection. You've got muscle, you've got fascia, you've got skin over the skull,
Okay.
which act like padding. Your hair, believe it or not, plays a role.
Really?
Yeah, and then the spinal cord has thick layers of muscle surrounding that spinal canal for extra security.
So it really is like a multi-layered shield
No, absolutely.
with like each part having a very specific
Each
job
part has a very specific job.
to protect those VIPs.
And then it gets even more sophisticated.
Yeah.
We go even deeper than that.
Okay.
Protecting your central nervous system, we have something called the meninges.
The meninges.
The meninges.
The meninges.
Yes.
Okay.
3 layers of tissue that act like this super sophisticated suspension system.
Okay, so unpack that a little bit for me. The meninges, what's the deal?
Imagine a waterbed,
A waterbed.
but for your brain.
Okay, you have my attention.
Okay.
Tell me more about this brain waterbed.
Yeah, so that's essentially what's going on with your cerebrospinal fluid,
Okay.
or CSF.
CSF, got it.
This liquid that your brain and your spinal cord basically float in.
So they're just floating,
They're just floating.
living their best life.
Living their best life, and it's acting as a shock absorber to protect them from, the bumps and the jolts of daily life.
Wow, so our brains really are just like bathing in there.
It's very important.
That's incredible.
It is incredible how much thought literally went into protecting your central nervous system.
It's an important system.
It is an important
Like,
system.
important.
Even brief interruptions in your blood supply or oxygen can have serious effects on your brain tissue.
Wow.
Yeah. So it's a very handle with care situation.
Handle with care.
Yes.
Speaking of handle with care, let's talk about when things go wrong.
Okay.
Head injuries are a very common thing, unfortunately.
They are, and they run the gamut.
They really do.
Everything from minor bumps to very serious life-threatening situations.
Right.
So we categorize them broadly into 2 types. You have your closed head injuries, where there's no opening into the brain.
Okay.
And then you have open head injuries, where there is a breach and the brain is exposed to the outside world.
So a closed head injury would be something like a concussion,
Exactly.
which we'll get into.
I will definitely get into that.
But an open head injury would be something like, I would imagine, a skull fracture,
Yes.
where the brain is exposed,
Where the brain is exposed.
which sounds terrifying.
It can be very serious.
Yeah.
And both types can be caused by all sorts of things. Falls are very common car accidents,
Sure.
but even seemingly minor incidents can lead to head trauma.
Which is why it's so important, I would say, to be able to recognize the signs.
Absolutely.
Even if you think, oh, it was just a little bump.
Even if you think it was just a little bump,
Yeah,
it's important to be able to recognize the signs of a head injury.
totally. And so let's talk about scalp lacerations.
Okay.
What are those?
A scalp laceration is basically a cut on the scalp.
Okay.
And they might seem minor compared to, let's say, a skull fracture.
Right.
But even a small scalp laceration can bleed a lot.
Really?
especially in kids because the scalp has a really rich blood supply.
That's a good point.
It is a good point.
As a parent myself, when my kid gets a head wound, it's always very alarming
I can understand why.
because it bleeds so much.
Yeah, it can look a lot worse than it is. But again, it's always better to err on the side of caution and have a medical professional look at it.
Especially with little ones,
Especially with little ones.
because their heads are very precious.
Very precious.
So let's talk about skull fractures.
Okay.
What exactly is a skull fracture?
So a skull fracture is basically a break in the skull.
Okay.
And the most common type is a lineal skull fracture,
Okay.
which is like a crack
Okay.
in the skull.
And I imagine those are kind of tricky
They are tricky.
to diagnose
They can be.
because you can't always see them.
Exactly. You can't always see them. Someone could have a linear skull fracture and not even realize it.
Wow.
That's why medical evaluation after any head injury is so important.
Yeah, even if it seems minor,
Even if it seems minor.
you could have a cracked skull and not even know.
Exactly. And then on the more severe end, we have things like depressed skull fractures, which are caused by a really forceful blow that actually indents the skull inward.
Oh my goodness.
Yes. And then you have basilar skull fractures,
Okay.
which occur at the base of the skull and can cause remember that brain fluid?
Yes.
The leak from the ears?
And isn't that how you get like raccoon eyes?
Exactly.
The bruising around the eyes?
That and something called battle sign,
Battle sign.
which is bruising behind the ear.
I've heard of that.
Yeah, those are both pretty clear indicators of a basilar skull fracture.
And then last but not least, you have the open skull fractures,
Yes,
which we talked about. Those are the ones where the brain is exposed.
exposed to the outside world.
Yeah.
Those are the most serious type with a very high risk of infection and unfortunately a very high mortality rate.
Yeah.
So that just highlights how important prompt medical care is.
Really drives it home that the brain is very precious
Very precious.
and vulnerable
That's
despite
all of its layers of protection.
all of its layers of protection. So what happens when the brain itself gets injured?
So then we're talking traumatic brain injury,
Right.
or TBI.
TBI.
And these injuries can be caused by a direct blow to the head,
Okay.
which we call a primary injury,
A primary injury.
or they can be caused by complications that arise after the initial injury,
Oh, wow.
which are known as secondary injuries.
So even if that initial impact doesn't cause, the most significant damage, things can happen later.
Exactly. Things can happen later that make the situation worse.
Oh, wow.
So these secondary injuries can include things like swelling of the brain,
Okay.
bleeding within the skull,
Okay.
increased pressure inside the skull,
Oh, no.
and infection.
So a lot of things.
A lot of
Okay.
things. And sometimes these secondary injuries, they evolve over time.
Oh, right.
Meaning a person might seem okay at first,
Right.
and then their condition deteriorates.
Which is why you always hear, even if you think you're fine after a head injury, go and get checked.
Exactly. Early detection and treatment are critical.
That's good advice.
It is good advice. And speaking of complications, one of those that we just mentioned, increased intracranial pressure, or ICP.
Okay.
That's a major concern with head injuries.
Break that down for me. What is ICP?
Okay, so remember how we talked about the skull being like this rigid container?
Yes.
Okay.
Hard container.
And inside that container, you've got the brain, you've got blood, you've got CSF.
All the things.
When there's bleeding inside the skull, or if the brain swells, it's like trying to cram more stuff into a container that's already full,
Sure.
and that puts pressure on the brain.
And that pressure can damage the brain?
It absolutely can, and it can manifest in all sorts of symptoms. You might see changes in breathing, you might see a slower pulse headache, nausea, vomiting, even changes in the pupils.
Wow.
There's this particularly ominous triad of symptoms:
Okay.
high blood pressure, slow pulse, and irregular breathing.
Okay.
That's a major red flag. It's known as Cushing's reflex.
Cushing's reflex.
Cushing's reflex, yes.
So a slow pulse after a head injury is actually a really bad sign.
It can be, yes. Because usually you think a racing pulse.
Right.
Right, but in this case, a slow pulse
Means something's wrong.
means something is wrong.
It's like your body's like distress signal.
Exactly. So you mentioned bleeding inside the skull.
Yes.
There are a few different types of intracranial bleeds to be aware of.
Okay.
Epidural hematoma,
Okay.
subdural hematoma,
Okay.
intracerebral hematoma,
Okay.
and subarachnoid hemorrhage.
Wow, that's a lot of different...
That's a lot of different kinds of bleeds.
Yeah, bleeds.
Yes.
So let's start with epidural hematoma.
Okay.
Tell me about those.
So epidural hematomas, those are often arterial bleeds,
Good.
which means the blood is coming from an artery,
Okay.
and it tends to come out faster and under more pressure.
Oh, so it just like Accumulates very
It
quickly
accumulates very quickly and it compresses the brain.
and compresses the brain.
Yes, and epidural hematomas often involve something called a lucid interval,
Lucid interval.
where a person might briefly lose consciousness after the injury. They might wake up, seem relatively okay, and then deteriorate rapidly as that hematoma grows and puts pressure on the brain.
So it's like a ticking time bomb.
In a way, yes.
Yep.
And another hallmark of an epidural hematoma is a fixed and dilated pupil on the same side as the bleed.
Oh, really?
Yes, this happens because the pressure from the bleed can actually affect the nerves that control the pupil.
That's so interesting.
It is interesting how that works.
The human body is so bizarre.
It really is.
So if you were to see someone who was in an accident and, at first they seem fine and then they start to become drowsy or confused, and you notice that one of their pupils is larger than the other, that's a 911 call right away.
Absolutely. Time is of the essence in that case because surgery is often the only way to relieve that pressure on the brain.
Wow. Okay, so that's an epidural hematoma.
Yes.
What about a subdural hematoma?
A subdural hematoma is a little bit different.
Okay.
So in this case, the bleed is happening beneath the duramater,
Which
which is the outermost layer of the meninges. So the blood is accumulating between the duramater and the brain itself.
So instead of being like right up against the skull, it's closer to the brain.
Exactly. And unlike epidural hematomas, which are usually arterial bleeds, subdural hematomas are usually venous bleeds.
And a vein is what carries the blood back to the heart.
You got it.
So does that mean it would bleed slower?
It does mean that the bleeding is slower.
So these subdural hematomas are kind of sneaky.
They can be very sneaky because the symptoms might not show up right away.
Oh, wow.
Sometimes it takes hours or even days for them to manifest.
So someone could have this and think they're totally fine.
And then all of a sudden,
And then
they start to experience things like fluctuating consciousness, slurred speech weakness on one side of the body.
so it could be very subtle.
Very subtle, but incredibly dangerous.
Yeah.
Any suspicion of a subdural hematoma means getting medical attention immediately.
So like we were saying, better safe than sorry.
Better safe than sorry.
Especially when it comes to the brain. Okay, so we've talked about bleeding outside of the brain.
Yes!
What about bleeding within the brain tissue itself?
So that is called an intracerebral hematoma.
Intracerebral.
Intracerebral, yes.
Slimacoma,
And it's every bit as serious as it sounds.
I imagine.
These bleeds can be caused by things like penetrating injuries or really rapid deceleration forces.
So something like a gunshot wound.
Exactly.
Or a really bad car accident.
A high-speed car accident
Okay.
where the head is moving very, very quickly and then comes to a sudden stop.
And unfortunately, even with surgery.
Even with surgery, intracerebral hematomas have a high mortality rate.
Wow.
Which just goes to show you how delicate the brain really is.
This is really making me want to wear a helmet everywhere I go.
It's a good idea.
Okay, so last but not least, we have a subarachnoid hemorrhage.
Yes, subarachnoid hemorrhage.
Tell me about those.
So subarachnoid hemorrhages are bleeds that happen in the space where CSF circulates.
Right, so the brain's own personal jacuzzi.
Exactly, but in this case, the blood mixes with the CSF and it irritates the meninges.
Okay.
And people with subarachnoid hemorrhage often describe it as the worst headache of their life.
And these aren't always caused by some sort of trauma, right?
You're right. They can also be caused by something called an aneurysm,
Okay.
which is a weakened area in a blood vessel that can rupture.
So you could just be going about your day,
Exactly.
have a sudden headache, and it could be that.
And it could be a subarachnoid hemorrhage.
Wow.
And it can be life-threatening.
So a sudden severe headache.
Sudden severe headache.
That's a sign to call for help.
Yes, especially
Yes,
if it's accompanied by a stiff neck or any other neurological symptoms.
Okay, so I'm adding sudden severe headache to my list of reasons to seek immediate medical attention.
That's a good list to have.
It's a growing list, unfortunately, but
It's good to be prepared.
it is good to be prepared. Okay, so we talked about, bleeding.
Yeah.
We've talked about fractures.
Lots of different types of head injuries.
Lots of head injuries.
Yes.
What about concussions?
Concussions.
Because they're often considered to be,
A milder form of TBI.
a milder form of TBI.
Yes.
Exactly. So what are some common misconceptions about concussions?
So the biggest one, I think, is that you have to lose consciousness to have a concussion,
Really?
which is totally not true.
So you could get hit in the head, see stars,
Yeah.
feel dizzy, confused,
Yeah.
but not actually black out
Exactly.
and still have a concussion.
You can still have a concussion because a concussion is all about that disruption of normal brain function.
Right.
And that doesn't always involve losing consciousness. In fact, only about 10% of concussion cases involve a loss of consciousness.
10%?
10%.
Wow.
That's it.
That's really interesting.
It is interesting.
So what are some other signs of a concussion that people should be aware of?
So it can vary from person to person,
Okay.
but some of the common ones are dizziness, weakness, feeling foggy or disoriented, headache, nausea ringing in the ears, even mood changes.
Wow, okay.
Some people also experience amnesia, meaning they can't remember things that happened before or after the injury.
So if you're feeling off,
If you're feeling off
after you hit your head,
after you hit your head,
definitely get it checked out.
get it checked out by a doctor.
It's not worth it.
It is not worth it.
And, you know, it's important to differentiate a concussion from a contusion,
Yes.
which is essentially a bruise on the brain.
Yes, a bruise on the brain.
So even more serious.
More serious than a concussion because now you're involving actual damage to the brain tissue,
Right.
whereas a concussion is more of a functional disturbance.
So the signs can be similar
The signs can be very similar
to other brain injury.
to other types of brain injuries. So again, medical assessment is key.
It's so interesting how much damage the brain can sustain,
It is interesting.
even with all those layers of protection.
Even with all of its layers of protection, it's really quite remarkable.
It really is. So before we move on to spinal injuries, I want to touch on,
Yes.
you know, brain problems that are not caused by trauma. Like if someone has a stroke,
Yes.
can those look like traumatic brain injuries?
They absolutely can.
Wow.
Strokes, aneurysms, even brain tumors,
Okay.
they can all cause symptoms that mimic traumatic brain injuries.
So again,
Again, get it checked out.
yeah,
Don't try to diagnose yourself.
if you're experiencing
If you're experiencing something that's out of the ordinary, go to a doctor.
Okay, so we talked about the brain.
Yes,
Let's move on to the spinal cord,
the spinal cord.
which you know is protected by the spinal column.
Yes, which is that stack of bones that we call vertebrae.
The vertebrae.
Vertebrae.
Exactly, and those protect our very delicate spinal cord.
Exactly. And your spinal cord, it's like the super highway of communication between your brain and the rest of your body.
It's a big job.
It's a very big job.
So how do people typically injure their spines?
There are a few main types of forces that can cause spinal injuries.
Okay.
So one is compression, where the vertebrae are squeezed together,
Okay.
often from a fall or a direct blow.
So like diving into a shallow pool
Exactly.
and hitting your head?
That could cause a compression injury to the cervical spine, which is the part of your spine that's in your neck.
Got it. And then
And then you have hyperflexion and hyperextension injuries.
what are those?
So hyperflexion is basically bending the spine too far forward.
Okay.
Hyperextension is bending it too far backward.
I can see how a car accident would do that.
Oh, absolutely.
Especially like a rear end collision.
A rear end collision.
Yeah,
Here,
exactly.
that would be a hyperextension.
That would be a hyperextension injury.
And
And then we have rotation flexion injuries.
rotation flexion.
Rotation flexion, which involve both twisting and bending.
So those probably happen a lot in sports.
Yes, they often happen in sports like football,
Okay.
where you might get tackled in a way that twists your head and neck.
Yeah, that makes sense.
So all of these different forces, compression, hyperflexion, hyperextension, rotation flexion,
A lot.
just a lot of different ways to injure your spine.
A lot of ways to injure your spine. Yeah, and they can damage the vertebrae and potentially the spinal cord inside.
And so the severity of the injury depends on the extent of the damage
Exactly.
to the spinal cord.
So a complete spinal cord injury is the most severe,
Okay.
where there's no communication between the brain and the body below the injury.
Whereas an incomplete injury.
An incomplete injury means that there's some degree of communication remaining.
So someone with a complete injury might experience paralysis,
Exactly.
where someone with an incomplete injury might have some degree of movement
Some degree of movement or sensation.
or sensation.
It all depends on the location and severity of the injury.
It really does. The human body is so complex.
It is incredibly complex.
And now you were saying earlier that the cervical spine, so that's our neck,
yes,
is especially vulnerable.
it is especially vulnerable to injury.
Why is that?
Well, it has a greater range of motion than other areas of the spine.
That's true. We can turn our heads.
You can turn your head.
We're pretty far.
You have a lot of movement in your neck. And that means that it's not as stable as other areas of the spine.
So it's like the trade-off for being able to turn our heads so easily
Exactly.
is that our necks are more prone to injury.
More prone to injury.
So what happens if someone's been in an accident or they've had a fall and you suspect a spinal injury? What's the most important thing to do?
The most important thing is to immobilize.
You immobilize.
Keep the head and neck still to prevent any further damage.
Got it.
And that's where EMTs come in.
Okay.
They're often the first ones on the scene,
Right.
and their role is absolutely crucial in stabilizing the spine and getting the patient to the hospital safely.
So walk me through what happens when an EMT arrives on scene.
Okay.
of a potential spinal injury, what are their top priorities?
So first and foremost, they assess the scene.
Okay.
They need to make sure that it's safe for them to approach the patient,
Rush.
that there are no immediate hazards.
Right.
And then it's all about the ABCs,
They-
airway breathing, and circulation.
Those are the basic.
The basics of life support.
Got to make sure that they're breathing.
Exactly.
The heart's beating.
But in a potential spinal injury situation, they have to be extra careful when they're managing the airway and checking for breathing.
Because you don't want to move the neck.
Exactly. Any movement of the head or neck could make the injury worse.
So how do they check the airway if they can't move the neck?
So they use a special technique called a jaw thrust maneuver
Okay.
to open the airway without moving the neck.
Interesting.
And if the patient needs help breathing, they might use a bag mask device to deliver breaths.
Okay.
Again, being very careful not to move the head or neck.
So once they know the patient is breathing and their heart is beating, then they can move on to actually stabilizing the spine.
Exactly.
Yeah.
And that usually involves securing the patient to a backboard
Okay.
or a special type of mattress that becomes rigid when inflated.
And what are some of the things that they're looking for when they're assessing someone for a spinal injury?
So pain is a big one, of course.
Right.
But they're also looking for any obvious deformities in the spine. It's all about teamwork and the right equipment. It depends on the situation.
Okay.
They might use a special type of stretcher that's designed to slide under the patient
Okay.
and then lock them in place.
So they're scooped up.
They're scooped up without really having to move them.
Wow, that's really interesting.
Pretty cool.
Okay.
And sometimes, let's say the patient is trapped in a car.
Right.
They have to use even more specialized equipment to get them out safely.
Yeah.
There are these things called extrication devices.
Extrication device.
Extrication devices
Got it.
that are designed to immobilize the spine while they're being removed from a vehicle.
Oh, wow. That sounds intense.
It can be.
Yeah.
And all the while, the EMTs are thinking about what additional injuries the patient might have sustained.
Right, because it's usually not just a head or spine injury.
Exactly. Rarely does that happen in isolation.
Yeah.
So they could be dealing with multiple injuries at the same time. They have to prioritize and be adaptable.
Right.
And you had said that, sometimes they have to make these judgment calls, like whether or not to remove a helmet.
Exactly.
How do they decide?
That's a tough one. So generally speaking, if the helmet fits snugly and it doesn't interfere with their ability to assess the patient's airway or breathing, they'll leave it on.
Right, because why mess with a good thing?
Exactly.
If it's providing extra support.
It's already doing its job.
Exactly.
But if that helmet is loose or damaged,
Okay.
or if it's obstructing their view of the patient's airway, then they might have to take it off.
Oh, got it.
And removing a helmet, especially if you suspect a spinal injury, is a very delicate process.
Oh, I'm sure.
It takes a team working together to stabilize the head and neck while very carefully sliding the helmet off.
Okay, so they have a lot to think about.
You have a lot to think about.
From, just assessing the scene,
Yes.
managing the ABCs,
Yes.
immobilizing the spine.
Making judgment calls.
It's a lot.
It's a lot of responsibility.
Yeah.
But they're trained for it.
They are incredible. They are amazing.
So we've talked a lot about the immediate response.
Yes.
What about the long-term outlook
Okay.
for people who sustain these kinds of injuries?
So it's true that the central nervous system has very limited ability to repair itself compared to other parts of the body.
Right, you said that the nerve cells don't regenerate?
They don't regenerate in the same way that
Right.
other cells do.
Okay. So is that it then?
So it's not a complete dead end.
Okay.
The field of neurorehabilitation has made incredible strides.
That's good to hear.
And there are all sorts of therapies and technologies that can help people regain function and improve their quality of life.
Okay, so what does the future hold for treating these types of injuries?
Well, one area that holds a lot of promise is stem cell therapy.
Stem cell therapy.
Stem cell therapy.
Tell me more.
So the idea is to use stem cells, which are like these blank slate cells, to repair the damaged nerve tissue.
So could they essentially become new nerve cells?
That's the hope.
Wow.
It's still experimental, but the early results are very promising.
That's good.
And then there's gene therapy, where scientists are exploring ways to manipulate genes to promote nerve regeneration.
Wow. It's like we're living in a science fiction movie.
I know, it's incredible, isn't it?
It really is. And then I would imagine, even just on a more practical level, there's always new devices and technologies being developed.
Absolutely. Things like exoskeletons, brain-controlled prosthetics.
Wow.
It's amazing how far we've come.
It really is.
And I have no doubt that there are even more amazing breakthroughs just around the corner.
That's very hopeful.
It is hopeful.
So we've covered a lot of ground today.
We've covered a lot.
From the basics of the nervous system to, future treatments.
The future is hopeful.
It is hopeful.
Huh.
What are some key takeaways you hope our listeners walk away with today?
I think the biggest one is to have a healthy respect for the fragility of the human brain and spinal cord. They are
Yes.
precious, they are vulnerable,
They are.
and they need to be protected.
Wear your helmet.
Wear a helmet.
Buckle your seatbelt.
Buckle your seatbelt.
Don't dive into the shallow end of the pool.
Don't dive into the shallow end.
All those good things.
All those good things. And the other big takeaway, I would say, is that even though these injuries can be severe, there's always hope.
There's always hope.
With prompt medical attention, dedicated rehabilitation, and, the incredible advances that we've talked about.
Yeah?
People can and do recover from head and spinal injuries and go on to lead full and meaningful lives.
It's great. It's been so fascinating learning from you today.
It's been my pleasure.
Making this deep dive into, such a complex and often overwhelming topic.
Yeah.
So thank you so much for being here.
Thank you for having me. So they have these special stretchers that are designed to slide under the patient and then lock them into place.
So you're not really like lifting and moving.
You're trying to minimize movement as much as possible. And then sometimes, like I said, if they're trapped in a vehicle, you have to use even more specialized equipment to get them out safely. There are these things called extrication devices.
Okay.
That are specifically designed to immobilize the spine while they're removing them from a vehicle.
Wow. So
It's pretty intense.
yeah.
And throughout all of this, they're thinking, okay, what other injuries might this person have sustained?
Right.
Because it's not always just one thing.
It's never just one thing.
It's never just one thing.
Right.
So they're thinking about, they could be dealing with multiple injuries at the same time.
Yeah, and they have to prioritize.
They have to prioritize.
Okay, so you were saying, with the helmets, sometimes they remove them, sometimes they don't.
It's a tough call.
Yeah, how do they decide that?
So generally, if the helmet fits snugly and it doesn't interfere with their ability to assess the airway or breathing, they'll leave it on
Right.
because it's already doing its job.
It's doing its job.
Why mess with it?
Exactly.
But if that helmet is loose,
Okay.
or if it's damaged, or if it's obstructing their view of the airway, they might have to take it off.
Got it.
And removing a helmet, especially when you suspect a spinal injury, is a very delicate process.
I bet.
It takes a team working together to stabilize the head and neck while they carefully slide the helmet off.
It seems like a lot.
It is. It's a lot to think about.
For these EMTs, from assessing the scene to,
Managing the ABCs.
managing the ABCs, immobilizing the spine, making judgment calls about helmets.
It's a lot of responsibility.
It's a lot of responsibility.
Yeah.
But they're trained for it.
They are truly amazing at what they do.
It's incredible.
It is.
Okay, so we've talked a lot about the immediate response.
Yes.
What about the long-term outlook for people who sustain these kinds of injuries? Because you had mentioned earlier that the nerve cells in the brain and spinal cord can't regenerate.
Right.
So is that it?
Well, they don't regenerate in the same way that other cells do.
Right.
It's true that the central nervous system has limited ability to repair itself compared to other parts of the body,
Okay.
but that doesn't mean that it's a complete dead end.
Okay, that's good.
The field of neurorehabilitation has made incredible strides, and there are all sorts of therapies and technologies that can help people regain function and improve their quality of life.
That's good to hear.
It is.
So what does the future hold for treating these types of injuries?
Well, one area that holds a lot of promise is stem cell therapy.
Stem cell therapy.
So the idea is to use stem cells, which are basically like these blank slate cells, to try to repair the damaged nerve tissue.
So could they potentially become new nerve cells?
That's the hope.
That's incredible.
It is. It's still experimental, but the early results are really promising.
That's awesome. And then there's also gene therapy.
Gene therapy, exactly where scientists are exploring ways to manipulate genes to try to promote nerve regeneration.
It's like we're living in a science fiction film.
I know. It's incredible, isn't it?
Yeah, and I'm sure there are like new devices and technologies being developed all the time.
All the time. Things like exoskeletons and brain-controlled prosthetics.
Wow.
It's amazing how far we've come.
It really is.
And I have no doubt that there are even more amazing breakthroughs just around the corner.
Oh, that's hopeful.
It is hopeful.
We've covered so much today.
We've covered a lot.
From the basics of the nervous system
to the future of treating these injuries.
to the future of treating these injuries. It's been fascinating. I've learned so much. What are some key takeaways that you want our listeners to leave with?
I think the biggest one is just to have a healthy respect for the fragility of the brain and the spinal cord.
Right.
They are precious, they are vulnerable, and they need to be protected.
Wear your helmet, buckle your seatbelt, all those good things.
All the good things. And the other big takeaway I would say is that even though these injuries can be very severe,
Yes.
there's always hope.
There's always hope.
With prompt medical attention, dedicated rehabilitation, and of course, all of these incredible advances that we've talked about,
Right.
people can and do recover from head and spinal injuries, and they go on to live full and meaningful lives.
That's amazing to hear.
It is amazing.
Well, thank you so much for taking this deep dive with me today. I feel like I've learned so much.
It's been my pleasure. Thank you for having me.